You are cordially welcome to the International Conference on Inclusion of Children with Disabilities in Sri Lanka, a model responsive to the country's social context, jointly organized by India, Japan, and Sri Lanka. A disability is not the setback, it is the beginning of some kind of change. So, this is the preparation to the start the preparation to start the work by lighting the traditional oil lamp. My respectful invitation for that, the Director General of NI in Sri Lanka, Professor Prasad Setunga, Associated Professor Miranda House, University of Delhi, India, Professor Upali Chakravarti, Professor Kumamoto University, Japan, Professor Hiruko Furuta, retired senior lecturer, the Open University of Sri Lanka, Dr. Anoma Alvis, the Director, Department of Inclusive Education at NI, and all other directors of NI, and former Director of Ministry of Education, Dr. Punnidasa, the Deputy Director General, Teacher Education and Alternative Education, Mr. MRW Madhuma, and other invitees. You are welcome to the Director of Inclusive Education Department of the National Institute of Education in Sri Lanka is invited to welcome you all by explaining the purpose of the symposium.
Hi, Bowen. Good morning, everybody. Director General, National Institute of Education, Professor Prasad Setunga, Deputy Director General, MRW Madhuma, and our distinguished guest, Professor Hiruko Furuta, Kumamoto University, Japan, Professor Upali Chakravarti, Associated Professor, Miranda House, University of Delhi, Dr. Anoma Alvis, retired Senior Lecturer, Open University of Sri Lanka, Dr. Punnidasa, retired Inclusive Education Director, Ministry of Education, and all the directors of NIA. You all are welcome for this international symposium. It's organized by the National Institute of Education, Sri Lanka, and Japan Society for the Promotion of Science. The aim of this symposium is educational inclusion of children with disabilities in Sri Lanka, developing a model that responds to the country's social context. Theme of the symposium is educational inclusion of children with disabilities from South Asian social context. I think it's a very valuable opportunity for our department and all the Sri Lankan education system. I think welcome all colleagues in Zoom sessions. Participants of 218 participants registered for this in Google Form. We welcome all the participants in Zoom link. Thank you very much for all. Thank you, madam.
Thank you, madam. Now we are going to start the presentations. Associate Professor Miranda House, University of Delhi, India, Professor Upali Chakravarti has been invited to explain the process of educational inclusion of children with moderate and severe disabilities in India. You are welcome.
Good morning to everyone. Ayubowan. And I would really like to thank Professor Setunga and Professor Furuta and Professor Anuma for inviting me to Sri Lanka for this symposium. And I'm very happy to see all of you over here. Um, I teach in the Department of Elementary Education in a college called Miranda House in the University of Delhi. And today I'm going to do a presentation on educational inclusion of children with moderate to severe disability and how in India, and a little bit, I want to start the presentation with what disability, how it has been viewed in India, what are the ways that we enumerate them, how is the education policy made, and things like that. So, in India, basically, the disability sector has been viewed initially from a very charity model. So you do donations, you do good, you do kind, so that you get good karma and it's seen with lot of pity that these poor things, we have to look after them, and it is our duty. If we do something good will happen for us in our future life. So this has been an underlying opinion which has always pervaded and been followed for disability. And then it came up with the medical model. A lot of work in science and medicine started happening. And then the medical model, especially of rehabilitation, that is, bring these people back as normal or help them to be as normal. So the whole idea is that you have to be normal. There is nothing like you can be different. So these two have been the primary models by which disability has been viewed. And most of the programs initially, they were modeled on this medical model of rehabilitation. And although now things have changed globally and the human rights model has come up, even India has adopted it. They have been signatories to many international declarations. However, this medical and charity model is still like the underlying base of providing services for the disabled persons. And so I begin my presentation with how many persons with disability there are in India. And initially, what happened was that when the British rule was there, they continuously counted the number of persons with disability. Once India got freedom in 1947, after the last British census, no census in India was conducted for persons with disability till 1981, which was the International Year of the Disabled Persons. So from 1947 till 1981, there was no count of persons with disability. So basically, they were not even considered people as citizens of India if you're not in that census. So there are two ways by which India does this enumeration. One is the census. So the last census was in 2011. We were supposed to have another one in 2021, but because of the pandemic, they were not able to organize it. And it is scheduled for this year, that is 2024. And we also have something, census is just only an enumeration. So they only just go house to house, counting how many people there are. And then we have something called the National Sample Survey, which does a sample of certain regions of the country and on along certain particular indices data is collected. So we have for education, we have for income, we have for economic status. So across India, so for disability also, there is a national sample survey which is done. Also, it follows the census. So whatever the census data is, just to give a little more understanding of that, we have this thing called the National Sample Survey. So as per the census of 2011, the differently abled population in India is about 26.8 million. And in 2011, probably the population of India was about some 1,210 or something like that. So the population was about 2.21%. There has been an increase in the number of disabled from the previous census that was done in 2011. So in a period of about 10 years, the population has actually increased while it should have actually decreased. But anyway, we'll go ahead with what is being shown. And of course, there are more men than women who have been enumerated for disability. The total number So this gives a aggregate of how the percentage of disability is highest in the age group of 10 to 19 years, which is a very critical age group. And the census initially, when in 1980, 81, when they did the census, only three disabilities were counted. That was disability of movement, disability of vision, and disability of speech and hearing. Mental disability was nowhere in the count, and speech and hearing were clubbed as one disability only. While in 2011, can we just go back to the previous slide number 3? I think it is. If we see, almost eight disabilities have been counted. So there are about eight disabilities which have been counted in the census in 2011. So that shows a shift in the perspective of the government itself, that they have now started recognizing that disability is not only three, but there are much more disabilities which have to be accounted for, because according to this only, then they can provide the various services for persons with disability. So then, and then in the next slide, we had seen of how age 10 to 19 years has the highest disability. And they also have show that the elderly, slide 5, in the elderly, they have most have disability of movement, and the elderly are 60 and above. In the next one, they have shown that disabled children in the age group of 5 to 19 years have attended educational institution. And they have said, if you see that the biggest, the blue one, says attending educational institution. The red one shows attended educational institutions earlier, but for some reason have dropped out. And then the yellowish green one says never attended any educational institution, which is quite a big number. It says 27%. So we can see that in this age group of 5 to 19, obviously at some point they start dropping out. So um, while 12% have not gone to school at all, haven't attended anything at all. So this is interesting in the way that how there can be many factors why this is happening, whether they can't access the education, whether they are actually so disabled that they can't access it. So I won't go into all those details, but this is just to show numerically how the people stand in India vis-a-vis education. So it says among the total disabled persons, 45% are illiterates. So while 54 children, 54% of disabled children with multiple disabilities and have attended or not attended educational institutions. So it's quite a large number that is not attending, even though the data shows that there is quite a lot who are attending. So in the not attending, it's probably all the severely disabled who are not attending. So this shows graphically of the educational status of disabled persons. So if we see, the blue ones are the illiterate. So in the total number of persons, most of them are literate, the 55%, the first graph. And amongst the illiterates are the males. In the second graph, if we see, 62% males are literate. And if you see the last one, the females, 55% are illiterates. So they have never gone to any education, or they haven't even got it education. And then we have, again, graduates are very few. If we see the last one, persons are, it's only about 5% who are graduates really. And amongst women, it's only 3%. So again, men are doing well. Men have more disability, but men are also getting many more of the services and provisions that can be seen from here, which I think all of us understand why that must be happening. And then after that, the next slide, please. We have the National Sample Survey results. The National Sample Survey gives a little more description of why this kind of data is there. So the prevalence, the incidence, and the kind of information that we can get. So difficulties faced by persons with disabilities, such as accessing or using public building, public transport, arrangement of regular caregivers, then out of the pocket expenses. That is actually the major thing, because there is actually no such thing like state services for all of this. So people have to spend their own money, and not everyone can afford to do that. And for education, in this, if we see the educational level, because this is a sample survey, the data is a little more exaggerated. So it's showing 7%, while when we saw the census, it was only at around 5%. But this is a sample, that's why. Um, Among persons with disabilities of age 15 years and above, 19.3% had highest educational level, secondary and above. So means a lot of intervention is going in, and they are accessing educational services. While among persons with disabilities of age 3 to 35, only 10.5. So the age range is much more, but the percentage is much lower. And percentage of persons with disability of age 3 to 35 years who were ever enrolled in ordinary school was 62.9%. So means a kind of inclusive education, or they may just be going to a regular school, is actually 62.9%. And this is very important. This data, if seen by with the help of the definition of disability, which has undergone a lot of changes in India, because earlier it was the medical model, then the charity model, then came the social and the human rights model. So as the disability definition started changing, even the way the services were provided also went through a change. So in this, if we notice, now the definition of disability includes what is known as a person with benchmark disability, means a person with not less than 40% of a specific disability. So this has included, this definition, change in the definition has actually opened the space for many more disabled persons to come into the field of education and not be excluded. So the government is working on a very, very strong inclusive education policy, because by just restricting their definitions to people who can't move, who can't see, who can't hear, they were restricting the access to services. But by allowing this kind of a flexible kind of a definition, many more person. This also adds to the awareness for other persons that yes, you can access educational services and it can make a difference to your life. So it has actually helped. We may say that many more benchmark disability people will be accessing the services, but it's also an awareness kind of thing generated for people around to come and start using the services. So the major categories, as it says, includes physical disability, which has locomotor, visual impairment, hearing impairment. Then it also includes intellectual disabilities. It has the definition has also started including mental health issues, disability due to chronic neurological conditions, multiple disabilities. So the uh, ambit of how many disabilities we can cater to has also increased. Some of these are the policies and laws that have been adopted in India, starting, this is quoting from 1999, but as I said, 1981 was the bench year when actually India started seriously thinking about disability and providing services based on that. So we have 1999 when there was a National Trust Welfare set up. In 2006, the National Policy for Persons with Disabilities was adopted. In 2005, there was a national curriculum framework. India has two national education interventions. One is a education policy and one is a curriculum framework. So we have the education policy followed by a curriculum framework. So every policy has a curriculum framework of what exactly has to be done. So if you see in 2020, the new national education policy was made. The previous one was in 1986. So after 1986, it has taken the government such a long time that in 2020 they came out with a new education policy, which has a lot of emphasis on inclusive education and inclusive education not just of children with disabilities or persons with disabilities, but also other marginalized categories have been included. So many of the domestic laws and policies on disability and education is one of the important one was the Rehabilitation Council of India Act. This was very important, and it actually set forth a lot of work in India because of this act, four national institutes were set up of different disabilities. Um, then we had the National Policy for Persons with Disabilities in 2006. And then we had the Rights of Persons with Disability Act in 2016. Following this act, we have something called the Samagra Shiksha Abhiyan, which is actually the inclusive education program for children with disability. And then, of course, as I said, we have the new National Education Policy 2020. So we see that all these policies, a lot of policies have been made, and but all of them have started thinking much more and in a wider way of how to bring about inclusive education. And if you see the trace the kind of history of how special education led to inclusive education. So, just a brief this thing of how special education to inclusive education came about. We had the Christian missionaries in the 1880s working with the charity model, and they established two schools actually. In fact, they established the for the blind in 1887 and for the deaf in 1888. Apparently, even in Sri Lanka, the two, or in Colombo, no? What's it? Professor Fruta had told me that two such schools were even set up over here, and they again were school for the blind and school for the deaf. So obviously, there was something which the Christian missionaries really thought of if they were establishing. And then for the mental deficient, it was in 1934 that so they were primarily the ones who actually started all this kind of interventions. And in India, NGOs played a very big role in this whole disability movement. This lady called Dr. Mithu Alur, she had a child with, she still has a daughter with disability, and she found no uh, services for her daughter. Then she, because she was very well off economically, she went off to England. And then that was an eye opener for her about how people work with persons with disability. And she came back and she did a lot of work in the area of disability. But then that NGO pressure focused on government initiatives to be taken. And then the Persons with Disability Act, the Sarva Shiksha Abhiyan, the Right to Education, the National Education Policy. Then this pressure from the NGOs brought about these changes in all these educational policies. We have a lot of government departments, various government departments working on the idea of education, inclusive education, and it is helpful. It looks like there are so many, and it's like too many cooks spoil the broth. But because intervention has to come from so many areas, it is good that we have so many departments also. So I won't go through the list, but it also was, does disability come under the Ministry of Social Justice, or does it come under the Ministry of Health, or does it come under the Ministry of Education, whatever. So from everywhere we had to have intervention, and of course funding, because without funds no work can be done. So this is just a list of all the government departments that we have. And in India, the way that education, special education or inclusive education actually came about was, initially we had these little units of neighborhood and regular schools, which showed that yes, there is a school for the disabled. There are these some children who come, they have a different school. So it was in the neighborhood of a special school, of a regular school, but not much attention was given to it. And then came this idea when Mithu Alur came back, then came this idea of special education, starting special units for children with disability. Home based education was another big thing which NGOs brought in, that it doesn't, if children are not able to come to the services, we can actually give it to them in the home. And then finally came inclusive education, which became mandatory. The government had to follow this because of the international declarations it had been signatory to. One very important and significant uh, policy came through what is called the National Trust Act. This was in 1999. It was mainly for the moderately and severely disabled persons. And it is, if you see, it says welfare for persons with autism, cerebral palsy, mental retardation, and multiple disabilities. So this in 1999, it was the first time the government recognized all these other disabilities also, rather than just saying there is one intellectual disability. So they recognize that these are different disabilities, they have different requirements, they need different services, and they can have to be included in different ways. So under this National Trust Act, we have many schemes and things, but primarily it was an act which talked about life insurance, health insurance, and educational come vocational training for persons with moderate to severe disability. They provided uh, daycare schemes, they had early intervention, they had respite care. Next slide, please. They even had a proposal for uh, a group home for adults. It was a very, very novel kind of a initiative of the government, of course, under the pressure of a lot of NGOs, especially NGOs run by parents. So they put a lot of pressure, and it came from this very great concern and anxiety which most parents of disabled persons have, is what will happen to my child after I pass on. So who will look after them? What will happen? And there was this great feeling amongst the persons with disability, parents of these persons, that my child should die before I die, because after I die, there will be no one to look after my child. So it came from this very, very heartrending concern, and the government actually took it up, and they said, we will provide residential services, we will provide health insurance, we will provide life insurance for this child. And it gave a lot of hope for parents with who had children with persons with disability. So under this, they focused on vocational training for older persons. So they had a program called Prerna, which is a marketing assistance. They also had a caregiving training scheme, which is called Sahayogi. And they had something called Gyan Prabha, which is an educational support. So it is still functional, operational, but it has slowed down because, again, funding is an issue. Parents were asked to contribute to it in order to get services. So it is still, it is there, yet it's not really working in that sense. So they're trying to revive it, but they are still working on it. Um, so but vocational training has been taken on in a big way, not just for persons with disabilities, but even for regular uh, students. And in this new education policy of 2020, vocational skill training is something which the government is emphasizing. And they have included persons and children with disability, include as well as promoting education at secondary level, senior secondary level, and at graduate level for persons with disability. And as I said, this National Trust, it had made a lot of inroads in the initial years, and it gave a lot of hope to parents. And the educational system for persons with disability, they have realized, comes from the open school system. So we also have a open school system called the School of Open Learning. and anyone can register in it, but you have to register through an institution. So when you have to register through an institution means you get counted. You are not just some random person who's going through and you are not accounted for. So they have to register through an institution, and this is being promoted by the government to include children with disabilities. So I would like to just end over here. If you have any questions or clarifications, you can let me know. Thank you so much. Thank you.
Thank you, madam. Thank you for your valuable inputs and research findings about moderate and severe disabilities in India. Next, I will invite Professor Prasad Setunga, the Director General of National Institute of Education in Sri Lanka, under the topic of educational inclusion of children with disabilities in Sri Lanka, policy and practice.
Good morning to everyone. Thank you very much, Professor Furuta and Professor Upali, joining with us to have this very important, timely discussion on educational inclusion of children with special needs. I think so. The organizing team explained, this is a knowledge sharing session. As you can observe, India is also kind of a same boat. Like very good start for me to start my presentation having this expression, so many cooks spoils the soup. I think in the Sri Lankan context, those cooks are saying their cuisine is the most delicious one. So that's the problem here. So spoilsies can manage, but my goodness. So I'm struggling as with the Department of Inclusive Education here, how to proceed with this so many cooks and the most delicious cuisine. So very nice presentation. So let me very quickly, I'm not going to take too much time. So I will keep some time for you to give us some thoughts from you. I can see almost 100 participants are there through online. The contents for the presentation is thinking about the international participants. I would like to give you 2 minutes explanation about the administrative structure and the school system in Sri Lanka. And then main focus is current educational policy initiatives. They are the cooks here in the Sri Lankan context. The policy framework by the National Education Commission, the same policy framework by the cabinet appointed expert committee. Unfortunately, we are planning to implement new education curriculum framework this year based on this second policy framework 2023 to 2033. And I will give you some summarized points based on these two documents. And then our NI's proposed national curriculum framework, how we are going to address this criticism. So the special needs children are unable to include. So how we are going to address that issue with this new package, and then challenges and way forward. So let me quickly explain educational administrative structure. You can see the NIS with the Ministry of Education, National Institute of Education. So we have decentralized the education, school education with 9 provinces. We have provincial level ministries and departments. So we are the line ministries all the time coordinating with this provincial authorities and implementing the education. So once the new education policy framework approved, this structure is going to be quite changed, like the role of the National Education Commission, even National Institute of Education role would be more strengthened. So that's the proposal. Like, so we will present you next time about this new structure. And the school education system, we have 5422 system currently. This is also going to be slight changes after this new policy reforms. We have very good primary education system that we have introduced this in 1997, 3 stages, and this junior and senior secondary. We are very popular with these exams. Love to have high stake exams here. The most popular one is grade 5 scholarship examination, and then GCO level and the A level examination. So I think the international participants may be very familiar with this UK-based education system. So this is the education system. We have I think, 19 government and some few very popular university system. So they are also very good in the international index. There are now some universities are in 500s, like, yeah. So with that background, let me start this 2 policy initiatives. First one is the policy proposals and recommendations by the National Education Commission. Actually, I think one of the stakeholders are there who contributed. I am also one of the contributors for this particular policy framework. So the first time, I think, in the policy initiatives, inclusive education and the special education proposals have been incorporated. They have identified 12 core areas. The first one you can see, access, equity, and inclusiveness. The National Education Policy Framework is really in line with the sector development, the Sri Lanka General Education Sector Development Plan. This is designed from 2020 to 2025. Actually, this document is quite nicely and the evidence-based piece of work. So while getting international donor cooperation, we have to have a good short-term and long-term plan. So then we can observe that the National Education Policy Framework by the National Education Commission is in line with the Sri Lanka General Education Sector Development Plan. I'm not going to explain here, but we can see this policy document is quite in detail. They have policy proposals like ensure equal access to all levels of school education, provide adequate facilities for marginalized children with an established mechanism to admit them into mainstream education, rationalize the classification of school system in the country. So they have strategic activities. I would like to focus on the second bullet point, the government to enact legislation to legally prohibit parents from keeping their children without sending to school. So likewise, we are trying to include all the children in line with this, the other relevant policy initiatives. And then detail policy statement, general education 1.2, the strategic activities. So they are proposing this legislation one and the scientific and systematic method to identify the marginalized groups of children, which includes children with special needs and disabilities, children of displaced families, and children of poverty-stricken families. And they are proposing how we can do it. Like we have very firm Grama Niladhari system at the grassroots level to the community, the identifying children, those who are unreached by education in their respective catchment areas, and then include marginalized children to the mainstream. So likewise, we can observe quite practical policy statements in this document. This document is now at the moment keep aside, and we are moving to another policy document, National Education Policy Framework 2023 and 2033. So this document is going to be approved by the Parliament very soon. We hope in January we will get full approval for this document, the partially approved by the Cabinet. So they have designed, this document is very the intensive kind of policy document, thinking about the economic crisis and the global agendas like global jargons, artificial intelligence, and personalized learning. And people are trying to leave the country. So thinking about this particular situation, the especially president wanted to appoint one particular expert committee to design the policy document. So this is the document, and they have divided the expected transformation into three domains: teaching, learning and credentialing, governance, investments, and resources. So we can see only one statement in relation to the inclusivity under the teaching and learning credentialing, inclusive learning approaches facilitated to benefit students with special needs. So this is the after analysis of this document, this is the statement in relation to the inclusivity. So I think with this statement, we can do a lot of things. So we are planning to incorporate all the activities under this statement. So so I'm not going to give you the very detailed information regarding this policy framework. Actually, once we got the full approval for this document, we can see our school system is going to be more student friendly, we believe. So this is up to the stakeholders. So they are trying to propose some amendments to reduce the examination-based system and centralized, so to address the high-stake assessments, like giving more focus on qualitative assessment. So likewise, if we can get the full approval for this document, automatically it's our burning issue how to incorporate the special needs children will be slightly addressed. Like, so this is the National Education Policy Framework. So let me then move to the National Curriculum Framework proposed by the National Institute of Education. So this is actually very long journey from 2019. The Education Reform Secretariat had been established at the Ministry of Education. They started, this is quite challenging time with COVID issues and having international support. This new curriculum framework has been finalized with a number of new amendments and proposals. The 2023, actually, the NI were ready to implement the piloting, but due to the endorsement by the new National Educational Policy Framework, the government wanted us to be keep silent. And then we are waiting to restart the piloting very soon after we have this formal endorsement to implement the education reforms. Let me brief the main characteristics of the 21st century skills framework for Sri Lankan general education. Generally, it can be divided into two sections: foundational literacies, interpersonal skills, values, and character like. So everywhere in the world, I don't know how about India. I think India also now the people are very borderless, and especially IT. Indians are working everywhere in the world. So now the reality is now they are inviting our children without A levels. They are waiting to invite our children with foundation qualification. So that's the reality. So thinking about the reality, we are planning to incorporate the 21st century skills and the vocational education, vocational skills like the stages of schooling, the primary education, junior secondary education, senior secondary, and senior secondary collegiate. So this is the purpose: education for basic life skills, foundation for life, foundation for career readiness, foundation for academic and professional life. So I think next slide, I think this is the slide I can give you some uh, some comments how we are going to address this to incorporate special needs children. The module-based school credit system, 36 credits a term, the 360 hours, reducing the number of subjects tested at the GCO level, more weight on qualitative assessment, inquiry-based authentic learning activities powered by blended learning, further learning areas focusing A-level and further education, technology modules addressing regional needs and specialization, introduction of innovative labs. We had this criticism, like I think I have incorporated two slides, how we are going to address this criticism. So we can't include special needs children with this very rigid system. So observing this proposal, we hope, we believe that we can do some changes thinking about the inclusion. I think the stakeholders are there about regarding this circular from the ministry. The next slide, please. The circular has been issued by the Ministry of Education. So how to practice inclusive education. So so with this proposal and the circular, this newly proposed reforms has to be practiced in line with this document. So I think one particular proposal, I think we did a collaborative joint paper with Professor Furuta, I think about to release the actual Japanese language one already been published at the University of Kumamoto journal. We fully analyzed this circular actually. Unfortunately, it is in Japanese, but the English one is also going to be published. So we focused on this strategic classroom design. So how to convert the special education units to practice inclusion. I had a discussion with the former director ministry, Mr. Punyadasa, regarding this matter as well. So this is maybe a huge challenge thinking about the reality, but I think we observe that this is quite practical proposal if we can implement, and thinking about the qualitative assessment system that we are going to propose, and then essential subjects and the further learning subjects. So we are going to give kind of flexibility to the system. Having this flexibility with this circular document, we need to work hard to implement the real inclusion. And only two slides remained. I think I will give you good time to the two commentators and the audience, even the online participants, to have a fruitful discussion. So before ending my just one slide, challenges and way forward, the huge criticism from the decades, the examination-based education system as a huge barrier for inclusion and specific features of proposed national curriculum framework. As I emphasized, this time we need to incorporate and practice inclusion in the very practical manner with this proposed education system. Expansion of the special education is one of the proposals, I think, many reports and attitudes of stakeholders in school education. So rather expansion, if we can, after converting the special education units to the strategic classroom in future, if we can reduce special education units and full inclusion, that would be the dream, but we'll see. So possibility to transform the special education units to strategic classroom. Awareness on disability inclusive education practices among school teachers and school community. This is we are doing actually all the time. And I also Department of Inclusive Education is doing a lot of awareness programs and the parents sessions, and they are visiting here with their children. They are struggling how to support parents to educate their children with disabilities. Actually, before moving to inclusion, they are struggling how to address the parents' issues. That's the reality of the Department of Education at the NI. So bit far for inclusion. All the time we are having discussion with this team. So that's the burning issue with the parents. So the schools are rejecting the children, so they will come to us and then asking us the solution. So that's the reality here. And application of the Inclusive Education Master Plan 2024-2030 by the Japanese International Cooperation Agency. This document is also quite comprehensive. All the stakeholders were there to produce this document. So we are observing, and so they are going to have their dissemination seminar very soon. The project will be finalized. So we need to get some outcome from this huge project, I think, spending a lot of money. Actually, we had a discussion at the UNICEF stakeholders, how we going to proceed with this so many cooks. And then we had a discussion if we can have a very good report based on this very good analysis about the current practices on inclusive education, then we can start kind of analysis and then start to proceed with all work that we were able to contribute. We have UNICEF. I think UNICEF is also one of the leading stakeholders, and World Bank and other organizations and the ministry, the Child Secretariat, the provincial level stakeholders likewise. So I think my conclusion is now we have quite in-depth evidences now. The practices are also very good. We have very good practices. When you visit the JICA website, they have already, I think, maybe going to publish. No, they have already published good practices from Sri Lankan inclusive education. I heard that they got more than 5,000 likes for that. So now we have good practices. Only thing is, if we can be silent. No, my cuisine is not very delicious, but you can taste it. I put very fixed spices for that, thinking about the Sri Lankan flavor. Why not? Please taste this and have a good good lunch or dinner, like with this cuisines, like so. That's the point. Now, my request is all the stakeholders, if we can start the journey based on this work to towards inclusion. Thank you very much.
Thank you very much for, sir, for your analytical inputs on disability education and inclusive education in Sri Lanka. Every child has equal right in the vast spectrum of education. The purpose of compulsory education is to provide the necessary education to the child with special needs. Professor Kumamoto University, Japan, Professor Hiruko Furuta has been invited to present her comments on previous presentation presented by the Professor Setung and Professor Chakravarti.
Dr. Sentunga, can you hear me? Dr. Sentunga, Director General, National Institute of Education, NIE. Chairperson, ladies and gentlemen, Ayubowan. I am Hiroko Furuta. Thank you for this opportunity to be the commentator for this symposium. I am so happy to be here today after many, many years. When I was with the Department of Special Education and Special Education Department of the NIE. And this is my first comment. Let us look back the history of special and inclusive education in two countries. In the early 20th century, the first special school was established by Christian missionaries under the British colony. Special schools run by NGOs have continued until now in both countries. In the government school system, special education continued as the integrated system. In the government school system, special education continued as the integrated system in both countries. Teacher training started as well. Then from the early 2000s, there has been a prominent move from special education to inclusive education. Please, next year. We can trace almost the same trajectories of the development of special and inclusive education in these two countries. Secondly, let us look into the sectors in charge of special and inclusive education in two countries. In both countries, education and educational service provision for children with disabilities has been conducted by two sectors, social welfare and education. Regarding the social welfare sector in Sri Lanka, Department of Social Services in both central and provincial government are in charge. And in India, Ministry of Social Justice and Empowerment in the central government, as well as state governments, and also Rehabilitation Council of India are in charge. For the education sector, Ministry of Education of the central government and provincial governments in Sri Lanka and state governments in India are in charge. In Sri Lanka, what I found so far is that there is a tendency among educationists to see only those children with disabilities who can go and sit in the school. This means since these educationists, their attention is limited to school-going children. Other children have been out of their vision, like the figure below because you cannot see well, unfortunately. Yep. So there are children with disabilities who are out of formal education, and some of them are getting educational services from social services sector. Some are not. So here I have 3 questions. Okay, and does this RCI works well in the area of inclusive education in India? Does the government in Sri Lanka try to include all the children, even with severe disabilities? And the final one is, in India, do the state governments continue working with the NGOs, and does that works well? These are my questions. If time allows, and if you presenters or someone else answer, I think it is good. Finally, I would like to mention today the recent trend of educational services for children with disabilities. This is the market-oriented special and inclusive education facilities targeting urban middle-income families. They have even qualified professionals. Special education should not be something for charity anymore in this modern society. These are newly developed social resources. However, the government sector should pay more attention to watch what is happening there and explore ways to be collaborated effectively with them. If time allows, could you or anybody else share your ideas regarding this trend? In conclusion, I found both countries traced the similar trajectories in this field in the South Asian context. At the same time, each country has their own education and social welfare system. It must be essential to develop education of children with disabilities based on social context of each country. Finally, from the bottom of my heart, I hope that the Sri Lankan people overcome the double difficulties of corona pandemic and the economic crisis soon in the future. Thank you very much.
Thank you, madam, for your valuable comments on previous presentation. Next, retired senior lecturer, the Open University of Sri Lanka, Dr. Anoma Alvis is invited to comments on perspectives of previous presentations.
First of all, I would like to thank Professor Upali and Professor Setunga for the detailed and informative presentation. According to the Professor Setunga's presentation, I felt that Sri Lanka is working hard to make inclusive education a reality. This comment is for Professor Setunga. So in his presentation, he mentioned regarding that circular recently issued by the MOE, strategic classroom design. So he mentioned in that circular, it is mentioned the students who reach the relevant development stage are integrated into a normal classroom. Yes, that is our hope. And the ordinary classroom teacher should engage in the learning, teaching, and evaluation process for the development of each student while paying attention on the needs of students with special needs in accordance with the general education plan. So that is the circular mention and hope to include more children into the mainstream setting. Once Furuta and I did a study in 2017, we found this. Teachers face stress or dilemma when balancing classes to meet the needs of both students with and without essay. That is the real situation. And through my experience, I hope the situation is the same in the country. So my concern is actually what is the teacher helper model suitable for Sri Lanka? So teachers need a lot of support. So we have to develop a teacher helper model. The next thing is possibility to transform the special education units into a strategic classroom. Actually, this is a timely, valid debate. It is my feeling that stakeholders should pay attention to this. Okay. And this is regarding Professor Upali's presentation. In her presentation, she presented in 2005, India adopted the National Curriculum Framework, which promotes respect for learners' diversity. So I would like to ask from her if she can give some example, 2 or 3, what are the new initiatives? Because your practices will be important for Sri Lanka.
I'll just start with Professor Furuta's comments. Does the powerful RCI still necessary in the era of inclusive education? Yes, it is still necessary because the Rehabilitation Council of India is one which is also like a monitoring body. So they issue, they certify persons who are special educators. They help to ensure that whatever curriculum, whatever services are provided have a certain quality. And so they are important to be around. And as we have seen, we have not progressed too much out of the special education uh, mindset. So we still require inclusive education hasn't really truly come. So till that moment, we will need to have something like a Rehabilitation Council of India to help ensure that the rights of the persons with disability are taken care of, because they can get lost in the government enthusiasm. Oh, now we have inclusive education. So in that way, we need a certain body to ensure this monitoring does keep happening. And it is, and we still require special educators. It's not that we don't require special educators, even in the initial, the way the inclusive education setup is being transformed. Because Rehabilitation Council of India not only looks after, because it's not just an issue of urban areas. India also has a very vast rural areas which also have to be monitored. So while we have the medical system, which has district primary healthcare centers, state level healthcare centers, then central level healthcare centers, this RCI has to be around to help negotiate and monitor all those services. So yes, we still need it. And yes, state governments still depend on NGOs. They do, because this has been quite a debate in India, because NGOs are doing a lot of work, but it is the state government which, or the government, which actually has the access to reach out to all the people in the country. NGOs are very, very specific. So you may have a rural NGO, but you may have a semi-urban NGO, you may have an urban NGO. They can only cater to that much around them because they don't have that kind of funding and that kind of reach. So while NGOs are still important because they are also like a pressure force on the government to also do things. State governments need a lot of support from the NGO sector also. But unfortunately, as all over, even NGOs are facing resource and fund crunch. And so I don't know how long they will last, but till they last, it is good work, because a lot of work that has been done in the field of disability in India has been because of the NGO pressure. And the NGOs have actually helped bring about this kind of inclusive education policy. And regarding this thing, uh, the National Curriculum Framework of 2005, um, it looked at disability in a very open way. The only negative aspect of it is that they focused a lot on learning disability. They focused on learning disability as something that they are doing for the disabled, which is unfortunate. However, they did come up with a lot of inclusive education classes for autism, for children with cerebral palsy, and a lot of work is being done for the visually impaired children. So they're not being included in the mainstream per se, but the national curriculum framework did start out with this, and they have done away with IEPs and things like that in because that is one way to actually means in the sense of the strict system of special education. The child is included in the classroom. They have not actually done things like just take the child out and certain things exclude the child. So while all the children are going for assembly, uh, sometimes some schools, what they used to do is that they would keep back the special education child. And so that child would not have any exposure to sports or PT or whatever activity. And they were made to study. So this curriculum framework actually helped bring out those aspects also, that yes, you can go into other fields also. Only academic studies is not the thing to focus on. And so, although they started with learning disability, uh, quite a few schools now take in autism. The only handicap of this is that it has still not reached the rural areas. So that is still, and of course, now they have dropped the 2005 framework, and now they are focusing on the 2023 framework, which has come now. And it is similar to what Professor Situnga had discussed. Foundational literacy is the focus. So even in our education policy and curriculum framework, foundational literacy and vocational training is a big thing. Thank you.
One more idea is, under the National Trust Act, we can see good practices in India, such as early intervention and school readiness, providing daycare facilities, insurance schemes. So I felt this is what I can see as a best practice in India that can be adapted to Sri Lanka.
Yes, yes, sorry, the last question.
Yes,
Yes,
yeah.
yes, yes, definitely, definitely.
Professor Furuta pointed out that there is a tendency to see only CWDs who can go to school, children with disabilities who can go to school are really, really concerned, but other children are out of the vision. So that was her point. Like, yeah, I think there are several reasons for that trend. When you go through the policy initiatives, the plan is to incorporate all the children's and the legal framework and thinking about this human rights model and the promote them to uh, come to enroll to the school. Uh, I think now this JICA proposed the uh, master plan. They have some very important components addressing this issue, I think. The first one is strengthen of regulatory and legal framework that is there. Facilitate measures for early detection and intervention of target beneficiaries. Like now, social welfare ministry is conducting some screening. Actually, they are very limited, not fully incorporated to the system, and no any good relationship with the school system. And again, they are proposing promotion of initiatives of in capacity building of parents and families to improve home-based learning. So likewise, I think rather, as you pointed out, rather focusing on the inclusive education regarding in the current system, we need to go through this full package like. So as you correctly pointed out, this issue is there. I am observing that this proposal is quite practical in that point of view, if we can legalize and incorporate. Your point, this teacher helper model, yes, if possible, this would be really practical. I observed when I was there in Japan in 2005 to do my sabbatical, I observed classrooms. My study was to observe classrooms in primary schooling in Japan. So I observed that this resource room and teacher supportive system with regular classroom teachers. So the all disabled children are there in the normal classroom. The register, marking the register is the classroom teacher, but time to time, the resource room teacher visits the classroom and ask the student to now shall go back to our place and then have some play and come back again to see your friends like. So that culture is really practical. And so we are struggling to change our attitudes of the general so-called normal students, how to accept disability, but that classroom, not necessary to have another programs to to change their attitudes. The friends, the so-called normal friends asking, you have to back on time. We are waiting your arrival again. So I can remember I reported that comments to my report. So likewise, we need to introduce really practical. I don't know whether we can have, team teaching, even this teacher shortage, but this proposal of this transformation of the special education unit to the strategic classroom, that teacher may be one of the good friend. So nowadays we had a huge experiences when we are when we are sending our students to schools to observe special education units, because I did 2 units at the Peradeniya Department of Education. So I proposed one compulsory module for 300 level Bachelor of Education students, inclusive education. So I conducted this module fully practical point of view. So only one module without exam at Peradeniya this time. All the students are leaving the examination. So the others are, oh my goodness, unfair. Like, so my module is having general jargons explanation and then send them to 2 special education entities to give a report. That's it. So, you know, uh, mm, changing mindset and the now my students reported me through their assignments. The special education units are isolated, like.
Yes.
So they are labeling like mad teachers, mad students class, like pissu teacher in Sinhalese, like. So those comments were there. So now, the really good comment, whether we can have this teacher helper model. So you also agreed with this proposal of the circular transformation of special education units. Yes. Percy, thank you very much. I think we have 20 minutes time. You can invite the online participants to get, or even physical, audience here.
Educational inclusion of children with disabilities in Sri Lanka, developing a model that reports to the social context of the country. You may have come to an understanding through the discussion so far. This preparation is to give you time to ask any questions or any clarification may you have about it.
And also believe that without inclusive society, we can't implement inclusive education concept properly. Therefore, first of all, we want to build up inclusive society, inclusive culture. Therefore, Minister of Education, we organize many TOTs. Through the TOTs, we up to now we trained more than 17,000 trainers in Sri Lanka. Our final purpose is 23,000 trainers for train our concept and about our circular and our new proposed systems. But unfortunately, all trainers not to train their staff and parents and other stakeholders of the schools. If they involve properly, we achieve real target, top of the mountain from a final purpose. But we not too worried about that. We know normally when we train 100%, more than 60 dropouts. Doesn't matter. Still, we not to give up our aim. Therefore, we hope to make YouTube and other videos for where our leading educationists and other people. When we aware them, they can understand how to we live in the inclusive society. We respect others. When we go to the bank, we have some sometimes we when go to the bank, severe disability person can't uh, immediately transaction. Then others that they give up them and don't care. Then we think as a education people, we want to change our mindset, our sector mindset. Otherwise, we can't implement inclusive education concept properly, especially normally, especially when specific learning disability student, we met grade 2 normal. Dyslexia, dyscalculia, dysgraphia, dysnomia, dyspraxia, auditor processing disorder, language processing disorder, many specific learning disability students we met after writing, grade 1 or 2, before not to met. Therefore, we can't provide special education for them. But if primary teacher can't work properly with that children with disability, they can direct them zonal special education assessment committees. We last month we uh, issue a authorization certificate for all zonal level assessment members in Sri Lanka. Then some northern province not to complete because primary ISS not trained up to now. After that, they also we can distribute their then for their certificate. After that, zonal education level, they can start their assessment. I not to like waste others' chance. Therefore, I stop now. If you want to understand in future anything, I can explain all ideas with our circulars, guidelines, and any other proper systems. Thank you very much.
Good morning. I'm Mrs. Olga Vijayatunga, a person who is joining via Zoom. Thank you very much for planning this item, and it's indeed to join and listen to your conversation. It's so valuable. It's a kind consideration, a request. I am a person who will be completing education on special needs education nearly in mid of this year. Also in profession, a music teacher, and very much interested in on music therapy for special needs students. I think we have come to a situation in the country where we need to get together and join hands where we can see for the betterment of these special needs students. Will there be any national gazetted policy or a curriculum, a program where the private sector and the government sector will get together, where we can have a program running, covering where all special needs children, including in the private sector and the government sector, can have a proper education plan? Thank you.
Yeah, this is a bit, very difficult question to answer very quickly. Yeah, our vision and the plan and the hope is also that the policy initiative is there now. The rooms are there. So let's together, let's hand join, and then I think you are maybe from the private sector. So there are no any limitations to do this at the government school and the private school. Once we have this approval of the circulars, definitely we can join our hands and implement those programs. Right. Thank you for the question.
Thank you so much.
I'm Mr. K. Disaron from Open University. Actually, that professional role in Sri Lanka, I want to tell that regarding. There's a model, customer model, in relation to the special disability, customer model. But all the professional in urban area, they follow that model in Sri Lanka. As it's my own experience. And in our school system, because I did numbers of research, that's what, regarding integration, how special unit support to inclusion. One more research, it was in Ampara district. Another research I recently did, inclusive education practices in particular district. And number of another minor research I have done. That's what I'm telling from the ground level. Integration, I hope it, goal of the integration is developing students in the special unit or special class and sending to them inclusion. But still some school has practice. They send back the student from regular class to special education unit because of awareness, lack of the awareness. And we are talking regarding collaborative teacher helping model, strategic model. But still there are teachers have isolated who are in that regular school, in the same school, who are in the special unit, they themselves are isolated. Therefore, we need inclusion from their practice and all. And NGO's task is very important, and they played very good role. But I observe some that how they use their resources. I visit one school. There was a braille indicator tiles and measures for physically impaired children to walk, but no any visual impaired student accommodate in that school, no any physical environment. So how they use that resources? In another zone, there were 5 students totally visually impaired, but no any measures for them to like that. So we won't have that mechanisms to observe those kind of things. Inclusion from heart, not from there. So because I'm working with them, I'm working for them. That's what it's my idea. One thing I want to tell, inclusion should be with mainstream. But our Ministry of Education level also, it's with non-formal.
I'm Shanti Dawson. I think you all may know me. I take this opportunity to thank Professor Upali and Professor Setunga for giving us more information about both countries and Sri Lanka and India. We know India is our neighbor country, and we have studied a lot and I have read a lot of literature about this inclusive education policies and the implementation of inclusive education. And also India has a long history, starting of the special education classrooms, after that from special education to inclusive education. So the same way, we know Sri Lanka also taken lot of initiatives, steps to implement both the ways, special education and the inclusive education. And also from 1994, after the Salamanca reports and all the awareness, so Sri Lanka's educational authorities have taken very interesting steps to implement this inclusive education. And we also worked as the special education professionals, and we worked and we tried our best to promote these concepts and also the steps of inclusive education. So still we see the inclusive education concept is in the growing rate. And very recently, we had a research with the general education teacher about the awareness of inclusive education concept and the policies. So now, when we are comparing then the 10 years after, now the general education teachers are knowing very well about these concepts, and more of their teacher education courses they have these inclusive education concepts and the contents. So they, however, they have read those and now they know, they have the idea. And but our, as Professor Setung has said, that our examination culture, that is a disturbance to the even the both parties, special education and the general education teachers, to implement. The teachers have their attitudes very well, but the examination process are sometimes giving disturbance, and these teachers, some schools we found, some children are after O level, when they come to O level, and again they have sent back to special education classrooms. So these cultures also they are. But I think if our country is taking steps to make aware of general education teachers very well only. So here also more of the special education professionals are seated and we are talking about the inclusive education. But like this in future, I think more of the general education professionals should be discussed like this and to promote and take care of these children with disabilities in Sri Lanka. As Dr. Fruta said, that the severe disabilities still, that is very worst in the rural areas. We see than the Colombo and like city, rural areas, there are a lot of children still remains at that home. They are lying on the beds, and the parents also very poor. They are unable to bring the children even to the school or to the hospital. So in future, like Dr. Setunga, Professor Setunga, you are the policies you all are the leaders of Sri Lanka's policies planning. So if you are giving a very big concern to bring these children out of their homes and giving education or even the medical side or the welfare side, it will be very interesting and it will keep the children come to the inclusive society that Mr. Punyadasa says. I thank you. We got a lot of ideas, and this is the situation in Sri Lanka. And we are also doing our best to promote this inclusive education among our schools. Thank you very much. Thank you.
wanted to make regarding this examination system. Even the Indian education system has this examination, but the only main examination which counts in terms of qualification for any job is the class 10. I don't know, you call it A level or O level, I don't know, whatever. The class 10 exam. So at that stage, now many of the private schools have adopted the open learning system. So they let those children go through the open learning system to take the exam. So in the open learning system, they don't have to take the full package of 5 exams or 6 exams or whatever it is. So they can select certain subjects and do it. So that has also actually in the 2005 that you were asking, that is one thing which has come about. So it has opened up the field for children with disability. So while class 5, 8 and all, that is not so important. Those exams are not so important. It is that one because based on that, you get your any profession also you can join. So they consider that examination. So that one they have made now flexible, and many private schools have adopted it. So that is something which can also be tried. Thank you.
Ministry of Education and Department of Examination will prepare providing facilities for school level and national level examinations, conducting formative and summative assessment under the 5 categories. First category is fully blind and visual impairment. Second category is fully deaf and hearing impairment. Third category is physical weaknesses. The third category, fourth category is various kind of children with disabilities included. Fifth category is specific learning disability categories, 9. On the other hand, lecturer Katie Soren told some details. I want to reply about that. Normally, we make teacher guidelines. According to that guidelines and circulars, next year we'll start our new system, new methodologies. Then after February, then after next year, within 3 years, all students must try to promote to the grade 1 classroom from the special education unit. No more years stay in the special education unit. For the example, my deputy principal's son learning in the special education unit up to 24 years old. It is wrong. According to our guidelines, within 3 years, we must promote them to grade 1 classroom. Since next year, we start that system. On the other hand, we make all guidelines and other circulars. According to that, we can implement properly since next year. This is law in the Sri Lanka. We have constitution, we have some acts. If we have no acts or constitution, we must follow 125 and 126 para Supreme Court and Appeal Court decision. Supreme Court decide article case, human right case. All circulars are law in Sri Lanka. Therefore, these circulars must follow all officers of the government sector. Otherwise, auditors can audit and start the audit queries. Therefore, we, on the other hand, as a freelance, outside pre-citizen, we can go to the courts through the NGOs against the government officers. Why I am not government officer, then we can go to the courts if who are the not to support to the circulars implemented.
There is one, we have very limited time, only 2 minutes, like one, there are number of text messages. There are lots of students with disabilities who are willing to go to school. Unfortunately, most of the schools rejected them. Those who have the ability to provide homeschooling are providing education to their children, but there is a huge amount of children who deserve to get their basic education. How can we help such children? In COEs, there is a course special education. Only they work with those children in their block teaching and internship. I think it's a good giving practical experiences once a month other than routine. Like so, there are now the yes that the circulars and regulations and policy initiatives are there. The Ketheeswaran, Mr. Ketheeswaran pointed out the reality of the school system. So yes, now the awareness, even go to the courts, those parents may be not aware, you know. So likewise, we need to think about the reality and how to change the system, maybe from the grassroots level. So now, you know, to address this issues now, that's why I prepared that one slide there about the new curriculum framework. If we can reduce these subjects and give the flexibility to the classroom and these modules, maybe we can input some points, the friendly, more disabled children like. So those are the practical measures should be taken to address these issues like, yeah. Thank you.
My question to Professor Pali. We have heard that the Sarva Shikshan Abhiyan program Coimbatore in India, it is very important develop inclusive education in India. How do you see that inclusive program as an Indian? How do you see that inclusive program program as an Indian in your?
Okay. Yes, Sarva Shiksha Abhiyan was a very unique initiative of the government. Again, it was actually UNICEF funded, and they played a very major role in helping children with disability come into the mainstream. And the highlight of this program was that it was not just urban based. It was actually a rural outreach kind of program to bring children with disabilities to schools. And they had like a package, and they even provided aids and teaching learning material and resources to these rural schools to conduct classes and to bring about inclusive education, so that there was no excuse that we don't have the resources to teach children with disability. However, unfortunately, the scheme packed up once UNICEF withdrew the funding. But the scheme worked. It worked in very, very dire circumstances, very, very bad circumstances also. So they just like had a little trunk in which they just put all the resources. And that trunk was like not opened for like years. But the fact is that UNICEF intervened a lot and did a lot of work to bring this Sarva Shiksha Abhiyan. There was also a universal elementary education program, the UEE, which also promoted not only universal elementary education for all children, but they also had this component of inclusive education, and that's where the Sarva Shiksha Abhiyan came. However, now there is no longer the Sarva Shiksha Abhiyan. It has wound up, and now we have this new thing called the Samagra Shiksha, which is again inclusive education. It is part of, it came in 2018, the Samagra Shiksha Abhiyan. And they propose that they will also work with children with severe and moderate disability. And it is part of the new education policy of 2020. So that's what. But Sarva Shiksha Abhiyan made a lot of inroads, and they actually generated a lot of awareness for children with disability, especially in rural areas, mountainous regions, far-flung areas such as the Northeast. The Northeast in India is a very kind of region which needs a lot of access and it has a lot of difficulty to reach it. So this SSA was very influential in that. Thank you.
Sarva Shiksha Abhiyan.
Abhiyan, yeah.
Abhiyan means what?
Abhiyan means scheme. It means like a movement.
Move.
Yeah.
So we can feel the Sanskrit meaning of the Sanskrit. That,
Yes,
no?
yes.
Yeah. Shiksha means in English education. Right?
And Sarva means for everyone.
Yeah, yeah.
It was education for all was the motto of UNICEF. And under that, the Hindi translation was the Sarva Shiksha Abhiyan.
Yeah, now the Sri Lankan Lamami Turu child-friendly approach, also the same concept conducted by the UNICEF actually now.
Yes, yes.
The thing is now, the projects are coming, they are very good projects, but inclusivity is there. One of the, I think, 6 is the inclusiveness, like now. The practice is really, really important. No? Even after the project, we can proceed those concepts. That would be the best solution for this. I think now time is, you can wind up and, yeah.
Thank you for all answering and questioning and answering and any clarifications. I think today we had a very good discussion about the inclusive education and special education in Sri Lanka. This is the end of our symposium. Now I will invite Mrs. T.N. Isra, Assistant Lecturer, the Department of Inclusive Education, for the vote of thanks.
Respected dignities on the dais, off the dais, invitees, participants, and dear colleagues. I am feeling honored to get this opportunity to conclude the International Symposium on Educational Inclusion of Children with Disabilities in Sri Lanka. Organize the International Symposium is a challenging task. This cannot be possible a great preparation-wise working hand, support from every corner, and blessings. Now it's time to convey our gratitude to all who have extended their support to make this event successful. We most humble to thank our Director General, Professor Prashad Setunga, for his extraordinary leadership and guidance and sharing valuable thoughts with us. Thank you, sir. I extended my thanks to Deputy Director General, Mr. M.R.W. Madhuma, sir, for his guidance. Thank you, sir. I am happy to offer sincere thanks to our speaker, Professor Upali Chakravarti, Associate Professor, University of Delhi, India, to adjust her busy schedule to travel so longer to reach here and sharing her valuable thoughts and knowledge, research finding. Thank you, madam. Let me express my gratitude to our commentator, Professor Hiroko Furuta, Kumamoto University, Japan, for creating an opportunity to host the symposium and sharing valuable thoughts. Thank you, madam. I convey my sincere thanks to Dr. Anoma Alvis, retired senior lecturer, Open University of Sri Lanka, for accepting our invitation in her critical situation and presence here. Thank you, madam. Let me express my thanks to the director, the Department of Inclusive Education, for your leadership guidance. Thank you, madam. I wish to extend my thanks to participants who are attending the symposiums via Zoom mode. It's nearly reached 97 persons were present on the Zoom today. It's a big support to us. I should forget to thank Dr. Dadapala, retired senior lecturer, Open University, Mr. Yakut, retired senior project officer, NIE, head of the department, Mr. Dune Singh, senior lecturer, NIE, for translating the presentations on time with tireless night. Thank you, Vinita Jini Miss, for your contribution to translate the document too. I thankful to my dear colleagues sitting here for dedication and support. I extended my thanks to Director and all staff from the Department of Electronic and Dissemination. Equally, I wish to thank the Assistant Director and his staff from Information Technology Unit and staff from the cafeteria and other departments also. I would like to thank people who have working behind this selflessly for the success of this event. Thank you all. Shall we meet again in another program? Thank you. Have a nice day.